or women who do no longer want to give birth. For instance, you are married and after some years, after your childbearing, you don't want to take in again. You can use this drug to manage yourself. But now, youths of these days have commonized the works of this drug and made it something that a kind of daily routine. That this is the only way to prevent taking in without even after having sex or engaging on sexual
In today's video, we are going to discuss about contraceptive pills. Then, you know that in today's world, contraceptive pills is mainly used by teenagers, and most of them do not even know how to make use of it. So our major aim of this video is to educate ourselves on how we can make use of it to avoid drug abuse, because drug abuse is something that is highly harmful in a human body, and most people that are using it, especially female teenagers, do not even know the implication. All they know is that they are making use of it. Please, before we continue this video, I would like you to press like and subscribe button. It will help in the YouTube algorithm. And the person that I'm sitting with is a medical practitioner. He's going to educate us on how we can make use of the drug, and the importance and the implication it can cause if we make use of such drug in a abnormal way.
Yeah, thank you so much for inviting me once again in your channel to discuss this very vital topic with people around or people in the internet. Now, first of all, let's uh, uh, try to explain this starting from the prospect of what we are expected of as youth. Drug abuse. We can't bring in contraceptives without mentioning drug abuse, because on a daily basis, youth are abusing it. Some are taking it ignorantly. Some are taking it because of they heard the name from other people. Some has been addicted to it. They can't stop. They can't do without it. Now, when we talk about drug abuse, we mean taking drugs out of doctor's prescriptions or taking drugs more than doctors prescribed, beyond doctors' recommendations, or you think you have known it, or you are taking it on your own, or it has formed a kind of an addiction onto you that you can't stop them. Now, let's bring in contraceptives. Contraceptives are drugs that will prevent you from taking in, even after engaging in sexual intercourses. Once you take them, you will see is that these drugs will help you not to take in. But let's first of all focus on the reason why this drug was made. Because I don't believe that people that produce this drug had in view of giving it out to youths, people who are yet to get married. I think one of the reasons why this drug was brought into place is to make sure that ladies or women who do no longer want to give birth, for instance, you are married and after some years, after your childbearing, you don't want to give in, take in again, you can use this drug to manage yourself. But now, youths of these days have commonized the works of this drug and made it something that a kind of daily routine. That this is the only way to prevent taking in without even after having sex or engaging on sexual intercourses with their co-guys or any other thing. Some can take this drug two sachets every week. Some can take it, in fact, every day. Some who are now into some illegal business are taking it on daily basis. So we will not undermine the fact that many are using the drug wrongly, but that is what we want to correct at the moment. Now let's focus on how this drug should be taken. We have many anti-contraceptives. Most of them we can get in our location. Some are not traceable, yeah? But with the one that we have in our locality, I will not mention any name. There is always limitations to everything. You are not expected to take contraceptives more than one in a month. And I will also say, as a practitioner, that unless you are no longer ready to give birth again in time to come or in future, you are not advised to take contraceptives by any means. There are better ways to prevent pregnancies or pregnancy, as the case might be, outside taking these drugs due to the dangers in it. I will still come down to the dangers in these anti-contraceptive, contraceptive drugs. I'll still bounce back to the dangers in it. Because most of us that are taking the drug don't even know the dangers involved. Your guy will buy it for you, then you take. You think he's helping you. He is not helping you. He's helping you to kill your future. Now, this drugs is capable of preventing you from conceiving in time to come. It can stop you from conceiving in time to come. The more you keep on taking it, you are enjoying the result of the drug. You can do anyhow, then you take it anyhow. Good and fine for you. It's very, very okay. But what about tomorrow? Once it damage your womb, you can never conceive again. And this drug have a chance of damaging your womb, but nobody will tell you that. Now again, this drug can cause headache while you're taking it, or migraine. Migraine is when you're having persistent and consistent headache regularly. Every day you're having headache. No matter the amount of drug that you take, you are still having headache. And we are seeing many in the youth among us having those headaches. Then what is the result of those headaches? Some of them might lead to something more harmful than we expect. So there are many other ways of preventing pregnancy. If at all you can't stay on your own while you wait to get married, but contraceptives are not advised if you are not if you still have a hope of giving birth in time to come. This drug is specifically made for women who are done with their child's giving, with giving birth. They are okay with the numbers that they have in the family. They just want to live and enjoy whatever they're having with their husbands. This is what they use to control their own pregnancy. But as a youth who is hoping to give birth in years to come, 2 years, 3 years, in fact, you are not married, but you are hoping to get married, taking this drug is capable of destroying your family. Because tell me, what is the product of family without child? So those that are taking drug wrongly or without doctor's prescriptions or recommendations, I think you are doing yourself a lot of harm, because a time will come when you look for solution and there will no solution. The better you handle this, the good for you. But you can still decide on whatever you wish to do. But the honest truth is that contraceptives is not good if you still have a hope or a trust in giving birth in time to come. But but if at all you have been making use of it, it's never too late to give it a stop. Some can be addicted to it. Now, the funny thing here is that many youths have discovered that since they're taking it, they can never conceive. Then they're now engaging on sex on daily basis. Now, engaging on this kind of phase because you have a backup, which is that those contraceptives, is very, very bad. It can cause addiction in time to come that you can never do without it. And two, it can damage your womb. We are talking about your family. It can prevent you from giving birth in time to come. So I think I have done a little bit explanation on contraceptives. I won't mention them, but we all know it from the explanation. Contraceptives are drugs that you take to prevent yourself from conceiving again. No matter the kind of affair you have, you will never take in if you take it adequately. But we should always consult or go to a doctor before taking any drug to avoid misfortunes in time to come.
Okay. Thank you for your advice. So, from your what you are saying that maybe the overuse of contraceptive, that is the as a kind of a drug abuse, can cause barrenness in future. So, and that kind of a barrenness is not something that can be cured in future. Okay, but the question I want to ask now is that let me say now that somebody it's no longer giving birth as a result of a contraceptive drug she have make use of in the past. Can the person conceive through IVF? Is it something that maybe through science, is it possible that the person can conceive again?
I will not give you a definite answer, but based on experience, I think there is 100% chance of uh, uh, getting pregnant through IVF. And there's also another chance of not taking it again, depending on the kind of damage that it has caused in you. And to get something right, there are people that might have been on this drug for years and they will not have this kind of issue. Our systems differs, but can you exactly tell what your system looks like? This is why we must take preventive measures instead of controlling measure. Okay.
Thank you for watching. Please, I would like you to comment on this video. Please press like and subscribe button. It will help in the YouTube algorithm. Thank you very much. Thanks for watching.
Thanks for watching.